Hello, everyone. Welcome to Industry Matters podcast. My name's Heather Trumm. I am with VGM. And once again, we have the talented Amanda Smithey with us from McKesson. We are on our fifth session in talking about how to be successful in the wound care business. And we have gone through four different sessions or four pillars, four buckets, whatever you want to call them. And we are on the fifth one today. And I believe it's not going to be our final, but this is in the success of wound care. This is kind of the last pillar we're going to give you. So session 5, what we are talking about today is the go-to-market strategy. So we have hit on each pillar something different. And now we have all this information. Where do we go from here? So our homework is done. Our program is developed. We have the right partners aligned with our company. The internal staff is trained. Now, how do we build a go-to-market strategy with a referral base? What does that entail, Amanda? And how do we start? Where do we start?
Well, I think the first thing that you need to do when you start to decide, like, okay, how am I going to do this? Like, how am I going to build up that referral base is to actually formulate a game plan. I am not one of those people that, well, even though sometimes I do it, throw things against the wall and see what sticks. I think that in this type of situation and scenario, especially when you're working with referrals, sometimes you only get that first chance to make that right impression. So you want to make sure that you have a game plan and deciding like where you are going to go and where you're going to start. I always recommend to folks when you first launch into surgical dressings, you don't want to just like take it all. Like you want to make sure that you're doing it right. So it makes sense to start slow, to pick like that one referral source that maybe it's one that you already service for other product categories or you've got some familiarity with, that they know that they're kind of that pilot referral for you. And then like that's a good place to start. Another good place to start too is with your existing patient base. So let's say we talked about this. I don't remember what episode it was. It might've been episode 1, even all the way back at the beginning, where we talked about talking to your existing referrals and finding out what other product categories they need. Well, if you did that exercise and you know that you have a subset that were also utilizing surgical dressings and getting them elsewhere, going back to those patients and talking to them about now you taking their surgical dressing orders and supplying them with those products. That's another good starting spot because they already have a familiarity with you. So that's really where I think about when you formulate that game plan, you're trying to decide what direction you want to go to first is what I call like the low hanging fruit. So find the referral source that I call a friendly, or look at your patient population that you have today and start there and start slow. Just make sure that you've got it down, like submit a couple of claims, like just kind of get the feel for it, get the flow for it before you really open up the floodgates. You're going to have misses. You're going to stumble because you do that no matter what you do. It doesn't matter what product category it is. Right. There were times when you first got started where you're like, oops. And so just let yourself have those oops moments and then correct. So that way, when you are ready to open the floodgates, you've already done the oops. I mean, there's always going to be something else that comes up, but you want the majority of the oopsies to be out of the way. So, and I think that comes with formulating that game plan and starting slow, being very methodical about where you're going to start and being very strategic.
Love it. And that's where your cheat sheet comes into play. So you can educate and, talk the clinical, talk the sales. And in regards to, that also comes back to the value prop that we talked about in episode 4. If your value prop is that you are a knowledgeable company and you are a valued partner, they're going to give you the chance to dive into the surgical dressing category. So, and I love the start slow. That's one thing I always tell, no matter what, like you said, no matter what category you're getting into, start slow.
I was going to say the other thing too is that when you think about it, you want to also make sure that with these referral sources that you're setting the correct expectations and you're setting realistic expectations. Because I think that's something that we get into a situation with a lot of times as HME providers is that we want to say yes to everything, even when we know that that's not realistic. And so making sure that we are clear with the referral sources and making sure they understand, like, this is what we can do, this is what we can't do, and having those conversations. Because when you think about it, what is the referral source looking for? They're looking for a partner. They're looking for somebody that's going to be their reimbursement consultant. And that is what the HME provider's role is. Yes, it is getting the product to the patients, but there's a lot that goes on in between that initial site visit that patient has with that referral or that prescriber, and then the relationship, and then that linear line that goes from that prescriber to that HME provider. There's a lot that goes in. There's a lot of relationship in there. And there's a lot of different moving pieces. And so just making sure that you're setting the expectations up front for how it works and what's expected, I think is very important and very critical as well too. So when you're getting started and you're having those conversations with the referrals, just being open, honest, having that communication. It's a two-way street. It's a partnership. And I think that's really important. Again, this is not specific to surgical dressings. That's with any product category, but I think it definitely makes sense in the surgical dressing space because there is a lot of back and forth that can happen.
Agree, totally agree. And then it also makes it easier when you set the expectations clearly up front. If something occurs or you get an order that maybe you chatted about, you can go back to them and say, we're not going to be able to fill this because remember when we had that discussion initially, we are not able to do, whatever the example is that you gave them or the rules and regs that you have to go by. If you talk about that up front, it just makes an easier conversation when something does come into play. And then how do you, to add on to that, how do you make how do you hold your referral sources accountable to keep those rules and regs that you kind of set, up front? What do you do? How do you make them accountable for that?
And I think, again, as an industry, we've done a poor job of holding the referral sources accountable because we're always afraid of losing one. And I get it because there were times, when I first was getting started, like the thought of losing a referral source was just like, that was like, I'm not sleeping for 3 days. What am I going to do? Like, I'm bending over backwards just to appease them when they were doing things that necessarily wasn't what we needed them to do. And so, we have to have the confidence and we have to have the courage basically to just say to them like, hey, like, these are the rules. This is what needs to happen. And just calling them out on things. They have zero problem calling us out on things when we have a misstep. And when I say calling them out, it's not necessarily that you're, upset with them or anything like that. And I'll give you an example. I think that's probably a better way to explain it, because clearly I can't right now. So what I think of is, like, let's say you've got a referral source they've been sending over documentation, their assessments for months now, and everything had been great. Like, they weren't leaving anything off. Like, every now and then there was a question, but not too much. And now all of a sudden, the last 3 weeks, you're getting all these assessments over, but for some reason, they're no longer checking whether something's been debrided. They're no longer adding that one little element that we absolutely have to have into the assessment is no longer there. And so instead of just constantly going back to them and having the same conversation over and over again, that's when you kind of have to do a reset and then go back to them and say, hey, I think that we probably need to do another in-service. It looks like, you guys were doing fantastic for months and making sure that everything was included in the assessments, but I've noticed that recently the assessments are incomplete. And, maybe they've got a new staff person or, whatever the case may be, whatever the situation is, that's what I mean by holding them accountable, not being afraid to say hey, it looks like, you guys are doing great. And now all of a sudden, your assessments aren't quite on par. What's going on? And so those are the kinds of things I think about when I say holding them accountable. It's not necessarily that we're getting pissed at them or yelling at them and telling them that they're horrible or anything like that. But we just want to make sure that they understand it's a partnership and they've got to do their part to help their patients get these products so that they can get the outcomes that they're trying to achieve. Just like we have to do our part as an HME provider, because they're gonna hold you accountable as an HME provider. So you should be able to do the same. And there's different ways you can do it. I used to do report cards with some of my referral sources. So I would have them rate me and grade me, and then I would grade them. And then, we just had a couple of little things that we were grading each other on, but it was kind of a fun exercise. I mean, it didn't take that long, but it was just, something else for us to have a conversation about. So, I mean, there's lots of different ways you can do it. You don't have to do like report cards. My mom was clearly a teacher, so it was just easy for me to do.
Well, first of all, that was a great example that you gave in regards to the debridement and going back to them and just having a conversation with them. And then two, I was going to ask you about your report card, because I know that's something that you always talk about when, checking in, basically. Back to the in-service, when you're like, hey, maybe we need to go, come back and do an in-service for this group because maybe there is a new person or whatever. I feel like even if you stay on top of that, like maybe whatever your referral source is needing more of, maybe once a quarter, maybe twice a year, going back and just doing an in-service to review items. I know that a couple of our HME providers that do surgical dressings that are very, very successful, they do that. That's a part of their education every year. So that's not a bad idea, just to go back and just check in. And it's a good way to see, what's happening, what's new, what they're hearing, to keep your, finger on the pulse. So great examples. And I love the report card. So you mentioned in the last episode, we had internal and external training. The internal training is to train your staff. And I'm assuming that the external training is, well, you did mention it, that it's training the referrals. So can you tell us a little bit more about that?
Yeah, and I think you hit on it just a second ago, was just like that in-servicing that you do there at the referral source. And there's different ways that you can do it. It doesn't have to be very long. It's not anything that's overly complicated. I am a huge fan of formalizing that for an HME provider, because I want to make sure that all of our sales and marketing folks that are out there working with the referrals are going over the exact same stuff, because you really want the experience to be the same for all of the referrals, no matter who their sales and marketing person is. So I do think that you do want to formalize that. But again, like you had mentioned, that the providers that are successful in the surgical dressing space, they are providing this type of education. There is at no point during a clinician's training, and Heather, you can attest to this, but there's no point in their training where they get sat down and they are like, okay, so today we're going to review how you get reimbursement for these surgical dressings that you're using. Like that doesn't happen.
Right.
So they don't know. They don't know that, hey, I can't use this alginate because that wound is not a full thickness wound. Because in their mind, they're like, well, I want to use this alginate. I think it'll work best. And it's not saying that treatment is wrong. It's just saying that treatment is not reimbursable. So that's two totally different things. And those are kind of some of the things that they can go over with that referral source during the training. It's just making sure that they understand, like, we're not telling you your treatments are wrong. We're just telling you that the way that the reimbursement is set up, they feel like there are other products that will get the same clinical outcome that would be more cost effective. And so that's why this particular dressing in this circumstance is not covered. And so I think, those are the kinds of things that they need to hear and understand. They need to understand that it's not you, HME provider, that's requiring all this documentation. That's the payer. Just those types of things going on in the in-service, I think, goes a long way. And again, solidifying that partnership with the referral source.
Absolutely. And even going through
this is a great one to, oh, sorry.
Nope, you go.
And that's also a great thing to do with other manufacturers as well, too.
Yes.
So like, let's say you decided that you're going to utilize Dermarite as your formulary or whatnot, and then you're working with your Dermarite rep. They've got a new product that they're launching. So you guys can go in and do a joint end service at some of these referral sources as well, too, where they're talking about their product and then you're following it up with how it's reimbursed. So it's not necessarily something that you have to do on your own. You can get creative with it. You can combine it with some of your manufacturing partners, with your distribution partners, lots of different ways to do it. You just want to keep it consistent.
Awesome. I love it. That's a great example, and absolutely tag team it. That makes it more fun too. I will say also with the training and education, going through each dressing and telling them, what is this dressing for and what is the usual change, that a lot of times that also the light bulb goes off. Like for some, if they're not really educated in wound care, they think maybe a foam dressing gets changed every day. When in fact, you want to leave that foam dressing on as long as you can, and the drainage
Yes.
dictates when you change that. So again, that's a re-education, or maybe it's a highlight, maybe it's something they've never learned before, but re-educating them on the function of the dressing, that also would be a good reminder, and it would be a good educational in-service to do for the staff.
Yeah. Different types of referral sources are going to require different levels of training, and some will require more hand holding than others. So when you think about it, what you talk about and go into detail with at a wound clinic is going to be, they're going to understand more of it because they're a wound clinic. They're trained in wounds. Again, I don't recommend that you guys go out there and start out in long-term care or start out in home health. I think that those are some, like we talked about, formulating a game plan, going slow. But I do think that those are some referral sources that are often overlooked in this space. And there's a lot of wounds there. But when you get to the point where you're going to start looking at long-term care and you're going to start looking at home health, you've got a lot of nurses that are there that are in the wound care role that have never really had any formal training on wounds. And so like Heather was saying, that a lot of the things that you're going to be explaining to them is going to hopefully click that light bulb for them. And they're like, oh, so I don't really have to do daily dressing changes. If the wound's not draining a lot, there's not really a need for that. And so you're going to end up helping to empower the staff that are at those referral sources just by doing this type of training, this type of in-servicing as it relates to reimbursement, because the way that the reimbursement is set up, it makes sense based on the intent of the products and what they are supposed to accomplish. And then that's how the allowables are set. And that's why the criteria is set the way that they are. So it will in turn, especially in those referral sources where they don't have a lot of education on wounds, it will make them better at their jobs and taking care of their patients just indirectly. You won't even realize that that's happening.
I love it. That's so true. And remember that the dressing is a small portion of what you're supplying to the patient to help them heal the wound. So there's all that other stuff that they need to be doing as well. And when you talk to the referral sources, you can educate them too on, taking care of the whole patient, not just the hole in the patient, and everything that's involved in that. And that could be a whole nother series of a podcast there, taking care of the whole patient. So you'll never run out of things to talk to the referral source about. So anything else, Amanda?
I don't think so. I think that one thing that would be really cool, and I know that we've talked about it, so I'm going to tease it, is actually having one more session with a provider that's actually just now getting started in the surgical dressing space to kind of hear how they've gone about it, where they had some missteps, where they've had some successes. I think that would be helpful for all of you guys that are out there that have listened to this entire series, which was supposed to be one podcast that we turned into multiple. I think that would be a fun one. And I think everybody would benefit a lot from that.
I think so as well. And I think we're going to try to do that. And so you can see what all of this is actually doing in real life, in real time. So Amanda, thank you. Listeners, thank you. I'm sure you have learned a couple pearls out there, and you can reach out to us, either one of us, if you have more questions. And thank you for doing this series. It's been fun. I've learned a couple little points and tips and tricks. Yeah, for sure. So thanks, listeners, and thank you, Industry Matters. And hopefully we'll get you back here for episode 6, and we'll get a real life person who's going through all these pillars and see what they have to say. So take care, everyone, and we'll talk to you soon.